The global supplements market is set to reach over 200 billion US dollars by 2025. There are supplements that claim to cure everything, including infertility. If you want to learn more about the safety of supplements and how to find the right ones for you, watch this video. I'm Dr. Lora Shahine. I'm a fertility doctor practicing in Seattle, answering questions about how to optimize fertility every single day. And patients ask me all the time which supplements to take, which ones are going to cure egg quality or fix sperm parameters. It is such a common question and topic for discussion. We had to have this video. You can find other videos here on lots of reproductive health information and videos on IVF, videos on fitness and fertility, videos on nutrition. Supplements cannot substitute healthy lifestyle choices, but supplements are important. The message is out that when you're trying to conceive, you should take a prenatal vitamin. It decreases the risk of some birth defects like neural tube defects. I'm going to have a whole nother video just on prenatal vitamins, but we know that supplements are important and supplements can claim a lot and they are not very well regulated. So this video, learning about the safety, understanding certain assumptions about supplements is absolutely crucial. And I'm glad you're here to watch it. Instagram is going to tell you that a supplement can fix any fertility issue. When you ask your doctor, don't be surprised if they shrug their shoulders and sort of say, well, it's probably not harmful. There's not really proof that it's beneficial, but maybe it's okay. You know, Western medicine trained doctors like me do not learn a lot about supplements. And what we learn is that the FDA does not really have a lot of oversight over what supplements claim and what ingredients are in them. And so doctors are often at a loss, and patients can get really mixed messages from these brands that are spending tons of money on marketing. I wish they would put that money more towards high quality ingredients, but it's also important to realize, and it's okay to be confused. There are news stories talking about how there's heavy metals found in some supplements. And a lot of times if you spot check supplements, they're just fillers and there is not actually the ingredients that are written on the label. So as a consumer, you want to learn more. You want to choose wisely and choose safely. And so that is what we're going to talk about. In this video, we're going to cover three main topics. Number one, we're going to review why taking supplements is so tempting. Number two, we're going to review common assumptions about supplements and how you need to understand what's an assumption and what's a reality. And number three, I'm going to tell you how to find safer supplements. So when my patients ask me about supplements, I just want to remind you, and I tell my patients this, supplements are just supplements. They cannot fix lifestyle choices. You have to focus on nutrition, exercise, sleep is so important, and stress management, but some supplements can be beneficial. So let's talk about it. But just realize you can't make really poor lifestyle choices and then expect a vitamin to fix everything. So our first topic, why is it so tempting to buy supplements? Supplements make promises. There are a lot of some supplements that say, I'm going to fix your egg quality. I'm going to cure male factor infertility. I'm going to help you get pregnant. And that is really tempting. Struggling to build your family, you can feel so out of control. We are taught in high school that fertility is really easy. Contraception is what we should be worried about and not getting pregnant when you don't want to. But that's not the whole story, because for at least 15% of the population, or 1 in 8 couples that are trying, when they stop contracepting and try to conceive, it is not that easy. Infertility impacts so many of us. And so you feel out of control. You feel gypped. You feel like, why is this happening to me? And supplements sell taking back control. They sell, I know you have this problem and I have the solution for you. You just have to buy this thing. And so, it's easy and it feels like you're taking an action. It feels like you are doing something by taking a pill. And that's really normal and natural. And we all want to feel that way. But when I ask my patients, say, what prescription medications are you taking and what supplements and vitamins are you taking? And they used to bring in huge long lists. Now that we're doing so much telemedicine, they'll just take their phone and show the counter, and there can be like 20 bottles of supplements and vitamins that they're taking or powders that they're putting in their smoothie. And I just think to myself, like, oh my gosh, like we cannot absorb nutrients from 20 different things. And when I ask, like, why are you taking this one? Why are you taking that one? People are like, well, my friend took it and they got pregnant the next month. And so I just really wanted to do that. Or, I'm following this influencer on Instagram and they said that this is really wonderful and perfect for fertility or my overall health. I just kind of keep buying them and I keep taking them. And, and then we kind of talk about like, oh, there's pros and cons of supplements, all that kind of thing. They kind of shrug their shoulders and say, listen, I will do anything to have a baby. If it's not harmful and it may help, then I'm going to do it. And the issue is that sometimes supplements can be harmful, and also just you get pill fatigue. There's just only so many pills that you can take a day. And honestly, if you don't choose very, very wisely, there are some times where ingredients can be harmful. So it's so important to learn about this. So what are some common assumptions about supplements? I know that you've heard this and you might even feel this way. The thought is if it's natural, then it's got to be safe. Or if it's for sale, on a shelf in your drugstore, especially in the United States, then it's got to be safe. I mean, why would something be for sale if it isn't safe and kind of doing what it promises? And we really are promised a lot by big business and marketing and things like that. But the assumption that natural is better, natural is a marketing term. Natural, the word natural means absolutely nothing, and it does not have a definition with oversight from the government or the FDA, but it feels good. Supplements can say they're organic, but there's not really oversight for what that means. There's certain marketing terms that make us feel better, but it's important to know that what you're actually ingesting might not be what's actually on the label. A big assumption about supplements and vitamins is that they are regulated by the FDA, and this is just not true. The FDA does have oversight and regulatory authority over prescription medications, but not supplements and vitamins. And here are some really important facts I want to share with you. If you go to the FDA website, it'll say dietary supplements are not reviewed and approved by the FDA based on their safety and effectiveness. Other important facts to realize and some statistics you should just be aware of. Approximately 50,000 adverse events such as organ damage occur yearly due to the use of dietary supplements. Another fact, approximately 2% of hospital admissions can be attributed to this. 20% of liver injury cases reported to the U.S. Drug-Induced Liver Injury Network are attributed to herbal and dietary supplements. And one research study found that fewer than half of dietary supplements tested were accurately labeled. And mislabeling can occur up to 80% of the time in products used for bodybuilding and performance enhancement. So now that we've reviewed a little bit about how it is totally normal to be tempted by the claims that supplements make, we need to understand that they actually can be harmful and they are not always what they seem. So the most important part of this video, how do you find supplements you can trust? So there's three main things to think about when you're looking for safe supplements, and we'll go into each one in detail in the video. Number one, you've got to review everything you're taking with your doctor or your healthcare provider. Number two, be wary of very strong claims that sound too good to be true. And number three, there are independent labs that can verify ingredients in supplements, and I want you to learn more about those. Okay, so point number one, why it's important to review with your doctor or healthcare provider what you're taking. Everything that you're taking, including your prescription medications and your supplements and vitamins, because they can actually interact with each other. So a great example is St. John's wort. It is an herb. It's found naturally in the environment and it's sold as a supplement. It's claimed to help with balancing hormones, helps with depression, immune issues. There's a lot of claims to benefits of St. John's wort, but a lot of people don't realize that taking St. John's wort actually can interfere with the effectiveness of other medications that you're taking. It can actually change the absorption and effectiveness of a lot of prescription medications and decrease effectiveness up to 70% of some of the prescription medications that you're taking. So you can't just assume when my doctor asks me what I'm taking that they just want to know my prescription medications. We also want to know about your supplements and vitamins. Another great example is some fish oil, especially at certain levels of supplementation, can interfere with a blood clotting disorder and make you at a slightly higher risk of bleeding. And that's really important if you're getting ready for a surgical procedure like an egg retrieval. So these things are really important to talk to your team about. Number two, just red flag if something sounds too good to be true. Like if the marketing is, this supplement is going to get you pregnant next month. Really? This supplement is going to fix your egg quality. This supplement is going to improve your sperm parameters by 100%. Like, just be wary. If something sounds too good to be true, just ask some more questions and do a little bit more investigation. And number three, this is really, really amazing. There are companies that brands can hire to independently verify the ingredients that are in their supplements. And I think this is really important, especially in the United States, where the FDA does not have oversight and supplements can get to market without being verified or tested at all. It's different in other countries. Actually, the Canadian equivalent of the FDA will require some testing and independent verification of ingredients and then also products once they go to market from their supplement companies. But that is just not happening in the United States. So there are companies, that are labs that will independently verify and test brands. Now, it's voluntary, and brands don't have to pay to have this done, but if they do, it's just another level of information and transparency, and it makes me feel more confident in what I'm taking when I see this. So I want to give you the examples of the 4 labs that are available in the United States. These are ones that I know about. Maybe there's more, but I know about 4. And so you can see the little labels that you can look for on supplements, and then give you some examples of brands that are doing this. So the first lab is NSF. So the NSF lab has actually been around and available since 1944. It's a global independent organization that will test and verify and even help supplements and other products look at standards before they even go to market and then test afterwards. And a great example of a supplement, and this is not sponsored, but a great example of a supplement that has the NSF label is Athletic Greens. Another great example is USP, or United States Pharmacopeia. It was actually founded in 1820 by 11 physicians that wanted to provide safe products or test things before they went to market, because they were seeing so many people being sold absolute nonsense with all of these claims back in the 1800s. So I think that's a really cool beginning. And the label is USP, and a great example of a well-known brand that actually within the last couple of years paid to get the USP label and is really trying to elevate the importance of transparency is Nature Made. And sometimes my patients are really surprised. Like, they are expecting that I'm going to, recommend a really expensive brand or something that is really focused on fertility. And there are some wonderful brands out there that do that. But Nature Made, when I tell people like, oh, it's actually independently verified, again, not sponsored, but independently verified, and it's got the USP label, look for Nature Made, they're kind of like, oh, really? Because like they've seen that for so long. And it just sort of seems like, oh, it's at every store I go into. It must not be that special, but it's really impressive that they did this. The third example is Underwriters Laboratory, which now goes by UL Solutions. Independent lab, helps with verification. And an example I found was that Walgreens, when they started their own brands of supplements, opted to use this label and help with independent verification. The last one that I'm going to talk about is Consumer Seal Lab, or CSL. And I'm really impressed with the very transparent process. You can go to their website, and again, I'll list it in the resources here. They really talk about exactly what they do for each of their brands. There's so many brands that use this one that you can just go to the website and search for the brand that you are using if you want to look it up. So I hope that that's helpful. When you go to buy a supplement and you pick it up and there's all of these little symbols, like it'll be like a K for kosher, it'll say, GF for gluten-free, V for vegan, like there's all of these claims. And it's hard to kind of know, like, how do you interpret this? There's so much stuff on this bottle. Well, each of these labs has their own little symbol, and I'll make sure and list it here because that can be really helpful to look for. You can go to the pharmacy and there can be like, you're looking for vitamin D, and there can be like 20 different options, and it can just really be overwhelming. But if this can be a way to narrow it down and to find some sort of way of independent verification. So a little recap, remember, nothing can substitute for healthy lifestyle choices. Supplements truly are just supplements, but there are ways that you can find safe supplements if you're going to take them. And so in this video, we talked about how it's so tempting to want to believe the claims that supplements make, but how sometimes they really can not have what they are listing on the label and the bottle. And honestly, sometimes it can be quite harmful. So you have to be very careful in choosing your supplements. Make sure you talk to your doctor, your healthcare provider about everything you're taking, prescription medications, as well as supplements. Be very wary of claims that are too good to be true, red flag, and look for supplements that are independently verified, but because it is another level of transparency. Nothing is perfect, but this is a great way to really narrow down the choices when you're really trying to find the right supplements for you. I hope you learned something from this video. I am actually really enjoying doing a deep dive into supplements because it's something that my patients ask about all the time, and I really want to help. So I hope that this helped you. Like this video if you learned something, comment with questions that you have, subscribe to this channel. I put a video on here once a week. There's so much to learn about your reproductive health. I'm Dr. Lora Shahine. Thank you for being here, and stick around for more learning.